My name is Shanika Anderson, and I will be doing a presentation on abusing the use of the emergency room. Emergency rooms were created to treat patients who are dealing with trauma or critical illness, and when there is not enough time to be presented at a doctor's office. The emergency accepts patients 24 hours a day, 7 days, no appointment needed in advance. Some patients that are teens are not critical, ill, or dealing with psychological issues. Makes the medical treatment difficult when they're presenting themselves to the emergency room. The frequent presence of these teens cause emergency room overcrowding and abuse. Abuse in the emergency room is ongoing and is becoming a priority over the critical ill. The true intentions of these drug-seeking teens will be unknown, while the doctor is curing the patients. Studies have been conducted to show that the frequency of drug-seeking patients are causing overcrowding in the emergency room. The teens need to be healed in a whole to stop the dependence on the medication to heal their pain. Hospitals creating a tracker record on how many times patients frequent for pain medication will decrease the abuse of emergency rooms. According to Reinberg, 2016, the rates at which narcotic painkillers have been prescribed and have increased dramatically, Gather said, end quote. So we now have opioids in the millions of American homes, and children and teens are exposed to them frequently. Patients of various backgrounds frequent emergency rooms for different illnesses pertaining to the cure of some sort. As Grover et al. 2012 advised, quote, the hospital ED has a case management program that functions to assist in the care and the management of difficult patients in the ED, particularly those patients frequently seeking emergency care for problems related to prescription medication addiction, end quote. The emergency rooms are coming with solutions to stop the frequency of non-medical issues to decrease the overcrowding in emergency rooms. Behaviors of the mental illness in teens are causing abuse in emergency rooms on a daily basis. Complaints consist of patients complaining of pain in the back, dental pain, and migraine headaches to obtain the medications. Behavior of mental illness is causing the abuse in the emergency room. Complaints consist of patients complaining of pain in the back. The patients are also requesting that they also obtain medication for their migraine issues. Also, the patients are requesting refills on the medication to fill more than one prescription for overuse. According to McGeary and French, 2000, quote, overall, the second most frequent record reason for drug-related ER visits was treatment for adverse health consequences associated with chronic drug use or chronic effects, while the most frequent reported reason was drug overdose, end quote. The patients are seeking the medications to use for non-therapeutic reasons causing overdose. These patients seek the drugs in a behavior like they cannot survive without the medication. The teens present to the emergency room with a chronic pain complaint, and the physicians do not have the availability or the time to realize or pinpoint the time of the point of pain because of the time and resources. So the physician is obligated to treat the teen with opiates and send them on their way. Emergency room across America is working on cracking down on this certain behavior shown by these teens. The hospital doing this by working with the state to implement a prescription drug monitoring program. The systems track what drug-controlled drugs are requested from certain patients. Cracking down on this behavior shown from drug-seeking teens should cut down the cost and time of use in the emergency room. The teens are seeking the medication to use them for non-therapeutic reasons. The number one complaint of the teens that's drug seeking in the emergency room is the doctors are doing an all systems review, and they claim that the cause of pain goes towards a 10. The drug seeking teen will yell out a Big Ten, and that the pain is everywhere. According to Pediatric Week 2013, quote, although rates of narcotic pain medicine use has been according to the 3 times high among white teens than their black Hispanic peers, white parents in the poll are less likely than black or Hispanic parents to be very concerned about narcotic pain medicine, and less likely to support policy to limit children's access to them, end quote. Abusing the use of the emergency room starts with the emergency room intake, and responsibility with dealing with the teen claiming complaint should be, like I said, done in a home. This persistence will motivate the teen to medically solve the pain management of their illness. Overcrowding the emergency room is a very serious problem among all emergency rooms. Solving the problem will benefit hospitals in $1 million.